You've probably heard of central sensitization. Today I'm going to explain to you the neuroscience behind this phenomenon. If you have an injury to your hand, your brain needs to know that. It needs to act on that. This is a mechanism of survival. Pain is so important. But how does the message from the hand gets to the brain, and the brain then has to do something about it? It has also this message from the hand to the brain has to pass through the spinal cord. And here is where central sensitization happens. So let's imagine this is Simon's hand, and Simon is a bricklayer, and he was working one day and then a heavy brick fell on his hand and caused a lot of damage. And these damages were damage to the tendons, the bones, and he had a lot of pain. And then his colleagues brought him to emergency. So what's happening is the moment that the brick fell on his hand, some electrical impulses went from his hand to the spinal cord. Let's say one from the bone, one from the tendons, one from the muscles. So let's say 3 electrical impulses reached the spinal cord. They enter through the dorsal horn of the spinal cord. And here, something very important happens. This first neuron that is bringing that information will connect. And when they connect, we say that they are making a synapse. So they connect with a second neuron, this blue cord here. And the second neuron will enter the brain through the brain stem, and then will reach, let me see here if I can make it reach the back of Simon's. So here, it's reaching through the brain stem, and then once it goes to the brain stem, goes to the thalamus inside of the brain, and then activates many areas there. So now you want the brain to know that there are 3 impulses arriving there. So this is electrical impulses, and this neuron here, it's inside this central nerve system. This is the peripheral nerve system, this is the central nerve system. It is here in this synapse that central sensitization happens. And when we say that there is central sensitization, it means that there is amplification. So this synapse can amplify that message. So the brain, instead of receiving 3 messages, 3 electrical impulses, now it's going to receive 6, 10, 50, 100. So this amplification that happens in the spinal cord when the first neuron connects with the second one is what we call central sensitization. In the next video, I'm going to tell you how we can stop these pain impulses and this central sensitization in this synapse within a few minutes. In this video, I will explain to you how central sensitization can be stopped by the brain at the level of the spinal cord. You might remember from my previous video that I introduced you to Simon. Simon was a bricklayer. He was working, he had an injury to his hand, a brick fell on his hand, and then there were injuries to the bones, the tendons, the muscles, the skin, that through the peripheral nerves brought this information to the spinal cord. And there in the dorsal horn of the spinal cord, there was a synapse, a connection, and this connection to the second neuron, this is now inside of the central nervous system, traveling up, goes to the brain stem, the thalamus, and reach many areas of the brain. We noticed that there were 3 impulses here, and now there are 6 here. This is the amplification, and this is what central sensitization is. Now, in this video, I'm going to tell you about another important pathway. So I'm going to introduce you to the descending modulatory pathways. What happens is, from the brain, we have neurons that also go to the brainstem down there, and they come down to the spinal cord. And here in the spinal cord, they can modulate, they can make things more amplified, or they can turn down. So how can we activate these descending modulatory pathways that come from the brain? I'll tell you this in the next video, but let me tell you first the story of Simon. So Simon went to the emergency, and then in the emergency, so he remembered there were nociception coming from the periphery, and his brain was receiving a lot of information about pain. All these 6 electrical impulses were reaching the brain. So what happened in the emergency? So his friends took him to emergency, and then there the doctor examined him, took an x-ray, there was nothing broken, and then just did some stitches in the skin, applied some antiseptic, cleaned the area, told him that everything was fine, his nerves were okay, nothing, no serious damage, and just, told him you don't need any analgesics, you don't need any painkillers, just go home, apply some ice when you get home, and you will be fine in a few weeks. So, by the moment that Simon reaches the exit door of the emergency department, he didn't feel pain anymore. His pain was gone. So his brain was not feeling pain anymore. So what happened? There was still nociception, because obviously the injuries that Simon had in his hand were still not healed. So those nociceptions were still reaching the spinal cord. But no impulses now are reaching the brain. The brain is calm. Okay, I don't need to feel pain anymore. Because these descending inhibitory pathways, these descending modulatory pathways are so powerful, they are controlled by the brain, that they inhibit these synapses. So it's the opposite of central sensitization happened. Central sensitization is amplification. Now we have inhibition of that synapses, everything quiets down, and he doesn't feel pain anymore. So in the next video, I'm going to show you how we can activate these descending modulatory pathways naturally without drugs. So today we are going to talk about how we can use natural methods to reduce, to eliminate central sensitization, to block the pain that is arriving at the brain. So let me just remind you what we learned so far. So we learned that Simon was a bricklayer, he had an injury to his hand, there were electrical impulses from his peripheral nerve to the spinal cord. The second neuron that connected with the first neuron here went to the brain carrying a lot of information. This was central sensitization, because you see here there's amplification. There were 3 electrical impulses here and 6 reaching the brain. But then we heard also, I taught you last time, that the brain has the ability to activate these descending modulatory pathways that come here to that synapses, that connection between the first and the second neuron, and block that synapses. So now Simon doesn't feel any pain. Right? We saw this last time, because this orange line here representing the descending inhibitory pathways is blocking the pain, the first neuron transmitting information to the second neuron. So how can we activate this orange line, the descending modulatory pathways, naturally? The best one is endorphins, releasing endorphins by doing movement. So our brainstem is where we have a brain's inner pharmacy. And this inner pharmacy releases a lot of endorphins, dopamine, enkephalins, even cannabinoids, endocannabinoids. So you can learn how to release those substances by natural methods. Exercise, sleeping well, laughter, enjoying, doing things that you enjoy. And also it's very important that your diet is very nutritious because you do need the nutrients to fabricate those neurotransmitters needed here by this descending pathway that will inhibit that synapses. Because even if there is injury, electrical impulses coming from the periphery, this inhibitory pathway can come here, block. So then you see your brain is not receiving any information about pain. That's wonderful, isn't that? And there is also a lot of mind-body interventions, meditation, relaxation, mindfulness that help these descending pathways to work and release a lot of those neurotransmitters. If you want to learn more about this brain's inner pharmacy, I have a full video on my YouTube channel. It's video number 142, and the link is here for you to watch. So today I'm going to tell you what happens when this central sensitization does not go so well and the pain becomes chronic. That is the sad part, because central sensitization is a normal phenomenon that happens to any of us. Just being human, our body is designed to amplify this pain here. It's expected, but then we are also expected to use the brain and use the descending pathways. This orange line here represents the descending modulatory pathways that come from the brain to the spinal cord, and stop this amplification, because central sensitization means that this injury from the hand that was created 3 electrical impulses now reaches the brain with 6 electrical impulses. So it's amplified, the volume of the pain is turned up. But in some sad situations, this central sensitization perpetuates, doesn't go away. This descending inhibitory pathway is not working the way it was supposed to. So I'm going to use another example. So in the example of Simon that we saw before, he had a good outcome, he had a good ending for this story. He went to the doctors examined him, told him that his hand was going to heal quickly, and Simon was pain-free even before he left the exit of the hospital. Now, let's think about someone else. Let's imagine that instead of Simon, this is Mike. So Mike also is a construction worker, another bricklayer, and had a very similar injury as Simon. And Mike had an injury to his tendons, his bones, his skin. However, Mike didn't go to the emergency after that, and he didn't know if anything was broken because he doesn't have insurance. Imagine that he could not go to emergency. So he didn't have any broken bone, but he did not know because he did not go to emergency to have an X-ray done like Simon went. And Mike was worried at home, feeling his hand in pain the whole night. And what happened was his hand was sending these electrical impulses to the spinal cord. The spinal cord was amplifying these messages to the brain, and the brain became aware that there was that lesion, but the brain didn't have information of what was going on. Is this serious? Is it not? So because the brain was not able to activate the descending modulatory pathways, because the brain did not know what's happening, and until the brain knows what's going on there, it doesn't activate this, because if it does activate the descending pathways, the person will be relaxed, the person will be happy, and then this pain will stop. But in the case of Mike, what happened was the more the time passed, the brain continued receiving these informations of pain. The central sensitization got even worse. So look, there was 3 impulses, electrical impulses here, a lot of impulses arriving at the brain. The brain did not know what was going on. But as the time went by, 3 months later, the injuries have healed. So there is no more nociception coming from the periphery. The tissues healed, but the brain still doesn't know. The brain is still worried about this hinge. And guess what? Mike is feeling pain. This is now chronic pain. And chronic pain from chronic central sensitization does not even need impulses from the periphery, because here in this dorsal horn is where these impulses are being generated, and the longer the time passes, the more central sensitization will happen here and generate more electrical impulses there, making this worse. So these descending inhibitory pathways are not being activated. This is chronic pain, and this is the mechanism how chronic central sensitization perpetuates chronic pain. In the next video, we are going to see how this can become even worse. How some people have pain that started in the hinge with central sensitization like this, but now the pain is spreading to other parts of the body. We're going to learn about that. In the previous video, we talked about central sensitization, which is the amplification of signals, electrical impulses that come from the periphery to the spinal cord, because there is an injury in a body part, let's say the hinge. In the spinal cord, they get amplified. The brain receives an amplification of pain because of the central sensitization that happens in the spinal cord, and is not able to activate the descending, the top-down pathways that inhibit these synapses here. And then I mentioned to you that in some people, they have chronic pain due to central sensitization, which means there is no more electrical impulses coming from the periphery because the injury here is healed, but the brain continues receiving a lot of impulses from the spinal cord telling that there is still pain. Well, so then we mentioned that some people, the pain starts in a body part, let's say the hinge, but then if this is not treated, the central sensitization continues sending impulses of pain to the brain. The pain starts spreading to other body parts. So I'm going to use a different analogy now. So we're going to leave this to the side, and I'm going to bring you my parking lot friends. So you probably have seen cars in a parking lot, and you know that many modern cars, they come with a built-in alarm system, right? And imagine that this is, the parking lot of a big department store, and the owner of this car came, parked here, turned the alarm on, and went shopping, okay? But then someone came to the other car here and shut the door very abruptly, and this triggered this alarm of this car. So this car alarm started making noise and alerting that something here was wrong. Because the owner of this car is inside of the store shopping, he can't come here and turn off the alarm. The other cars that also have an alarm system will kind of detect that electrical activity, and the neighboring cars will then start triggering their own alarm, the car. So it started with this one, so now this car alarm goes off, and then this one goes off, and then this one goes off, and this one goes off, and then people come to the parking lot and say, "Whoa, is there a theft here? Someone that tried to steal many cars?" No, it's just because it started with this one, but spread to the other ones. So this is what happens to our pain system, because we also have an alarm system in our body. So if you remember that central sensitization was alerting that something was wrong with the hinge, but the hinge really was healed already. But the neighboring areas, like if it was the hinge, now the forearm, the elbow, the shoulder, the neck, the other shoulder, it starts spreading. And that is because now all the areas are becoming sensitized. So this is why chronic pain spreads. we need to treat this central sensitization in the beginning. We need to identify and diagnose this right in the beginning. We need to make sure that we reassure our patients of what they have, that they have the proper treatment for acute pain, that they are informed about their injuries and the prognosis, what's going to happen to them. Because if they don't know what's happening, if their mind is still in the danger zone, they don't know what's happening to their hand, it's going to perpetuate that pain coming to the brain. So this is the last video of this series. I hope you enjoyed this explanation that I gave about central sensitization. And as I mentioned, I have many videos on my YouTube channel. Here are some of them for you to watch and learn more about it. I also have a free handout that I can give to medical doctors, healthcare professionals. Here is the link for you to download my free handout if you want to learn more about nociplastic pain. It's important that you know that many scientists and clinicians around the world are working hard to find ways to stop this central sensitization, to stop this spread of pain to other areas of the body. And there are a lot of scientific publications lately that are being done. Almost every day there is a new scientific publication on this topic. We are getting there. We still don't know how exactly to stop all of this, but we are getting there. It's not going to take too long. And please remember, this video is not intended to give you any medical advice or to diagnose you, but it's just for you to understand what's happening. It's for educational purposes only. And if there is any emergency while you're watching this video, please go to the nearest emergency department or call an ambulance. Thank you for watching today. Goodbye.